Hello, I'm Natasha von Imhof, and I am a senator from Anchorage, Alaska, and today is December 8th, 2020, and I'm recording my video newsletter for preparing to go into session. And today we're going to be talking about COVID. This newsletter is a little long. It's probably about 20 minutes, so I encourage you to grab a cup of coffee or make yourself a sandwich, find a comfortable chair. I'm also putting the script on the Facebook page as well, so if you just want to go to the text and skim, by all means, please do that as well. So we're talking about COVID. It has been a really challenging year. There are so many unknowns and so much conflicting information. Personally, I'm wondering, when will the pandemic end? When can we get back to business as normal? When will a vaccine be ready? It looks like pretty soon. This is really exciting. I also think, what happens if somebody in my family gets infected? Will we be one of the people that have mild to moderate symptoms, or will we be affected pretty severely? Will we experience severe symptoms? I do know that while older individuals with pre-existing conditions are most at risk, otherwise healthy people end up in the hospital as well, and that's a concern. As a policymaker, I think about our state and wonder, do hospitals have enough capacity and equipment? How will our economy recover? The economic fallout has been terrible. Businesses have had to shut down. People are losing their jobs. In Alaska, sectors like tourism, retail, hospitality, and fishing have been hit especially hard. Our kids, are we truly taking care of our kids right now? Are we properly educating our children? Schools have been shut down for months on end. I fear this will have long-lasting consequences, and not many of them very good. People are being bombarded by bad news daily. Daily case counts, daily death counts, business closures, employee layoffs, students who cannot access or succeed in remote learning. The constant negativity and the uncertainty and the isolation, I think, has really taken the toll on so many of us. In order to get some needed clarity, I have spent the last several weeks talking to medical experts, business owners, industry leaders, and constituents, as well as digging into the economic data and the impact of CARES Act money here in Alaska. And there's some good news out there, and I want to share it with you. So here's some of the good news. There are effective treatments available. Doctors know a lot more now than they did back in March, and there are proven drugs and therapies available, such as steroids, antiviral medications like remdesivir, monoclonal antibodies. These are proteins that mimic the body's immune system, and good old vitamin D. These alone, and particularly together, have been proven to be very effective in decreasing the severity of the disease, shorten hospital stays, and even keeping people out of the hospital entirely. This is great news. We're finding that masks work. If two people are wearing masks and come into contact with one another, the risk of contracting COVID is low. If they are also standing 6 feet apart, the risk of contracting COVID is nearly zero. And with herd immunity, we've heard this as well. Moderna and Pfizer have both already manufactured tens of millions of doses of a vaccine and are ready to hit the ground running once FDA approval is granted, which is expected to happen any day now. And with more people recovering, especially healthy younger people who tend to have mild or no symptoms, and the vaccines getting ready to deploy, we are closer than we think to achieving herd immunity. So we have some financial good news as well. I'm happy to report that there's been over $5.6 billion of federal money coming into the state of Alaska since April of 2020. And some of the highlights are, we've had $527 million for unemployment, $436 million for small business economic disaster or injury disaster loans, the EDIL, $1.3 billion in business paycheck protection program, the PPP loans, which much of those have been forgiven. We had $1.2 billion of CARES Act funding going into a variety of different buckets. Nearly $50 million went to nonprofits. $290 million went to small business in form of grants, and I've checked with the folks that distributed that money, say it's pretty much gone. It's been out in the community. $500 million went to municipalities all over the state. Anchorage alone received $156 million, and $10 million went to homeless programs with the Alaska Housing Finance Corporation. $800 million went to tribal governments and tribal health programs. $172 million went to the Department of Health and Social Services for equipment, skilled nursing, and free COVID testing programs. $28 million went to housing assistance and housing vouchers. And nearly $300 million went to direct grants to all sorts of areas like childcare assistance, energy assistance, schools all across the state, food assistance programs, and mental health programs. That is a lot of money for the state of Alaska, and it has done a lot of good. And without it, we'd be in so much worse shape. The goal now is to figure out where the money has gone to the detailed level as possible, figure out if there's any money left, because we have about a month to deploy it. Are there any gaps and who still really needs help? Because I believe the next round of federal relief money is being negotiated now, and states need to be prepared for it. So all that being said, though, money is not the magic bullet. It is limited right now to the calendar year, and it only covers certain expenses. Businesses, particularly those hard hit like hospitality, personal service, gyms, retail, they do need to earn income in order to keep their employees on payroll well into 2021, after the CARES Act money runs out. And they need to pay expenses not covered by CARES Act money. Bottom line, we must keep the economy going. Here in Anchorage, closing down completely all restaurants and bars in December, in my opinion, is not the best solution. All we are really doing is transferring the pressure to grocery stores. People have to eat. I was under the impression that restaurants in Anchorage have set up very good mitigation efforts, and the patrons are socially distanced from each other, they're sitting at separate tables. And with that in mind, why not lower the capacity to something like 50%? It's like, think of it using a dimmer switch, not a complete on or off switch. If businesses are not making money, they have nothing to pay in taxes to the municipality. Soon, municipalities will find themselves without funds to pay for the necessary services like fire, police, road maintenance, and schools. CARES Act funding is only for COVID-related expenses and cannot replace lost municipal revenue. The flow of revenue must be kept going. The economic system, I look at it, it's like a big Jenga tower. If we keep pulling out the lower blocks, shutting down the small businesses that support a community, laying off the employees that work there, the tower is going to collapse. This is the conundrum that we find ourselves in. Governments are tasked to look after the public at large, using the information that we have in hand. That means we look after both the sick and the healthy, both the physical health and the mental health, both the individual and the community. Due to sustained shutdowns, we have seen harmful effects on mental health. Emergency rooms are reporting an uptick in cutting, eating disorders, depression, anxiety, especially for people at lower economic incomes where the pandemic is hitting them the hardest. The CDC survey in June found that 1 in 4 young adults between the ages of 18 to 24 have seriously considered suicide. There's an increase in domestic violence. People who have cancer and need chemotherapy are not coming in for treatments because they are more afraid of COVID than cancer. And we are seeing a higher number of deaths from diabetes due to people missing their diabetic monitoring. What's the result? We are simply shifting the cause of premature death. People are now at increased risk of dying of alcoholism, suicide, cancer, heart disease. To me, this is a self-defeating sacrifice. The academic fallout from keeping schools closed for so long is having devastating effects on our children. Many working mothers are no longer able to work because they've had to quit their jobs to take care of their young children, as well as help them with the online learning. Or some families can't afford to quit their jobs and the kids are either in childcare not being supported with online school or being left at home all day unsupervised. A child's best chance of rising above economic challenges is a good education, which has been severely compromised by online school. And for low-income families who lack the technology and or family support to learn effectively at home, the pandemic has been catastrophic. By keeping schools closed for so long, children and teenagers are being required to bear the burden of controlling a disease from which they face little to no risk. I am confused on why education and teachers are not an essential service. The facts are that this is not going to end on New Year's Day. We can't keep certain businesses shut down indefinitely. We can't keep kids out of school any longer. The depression, the anxiety, the incredible academic backslide is too great. Data from contact tracers show that the virus right now is everywhere. It's basic community spread. Since most people don't feel sick or don't have symptoms or are mildly sick and think maybe it's something else, they don't realize they are contagious. So people continue on their normal lives, unwittingly spreading the virus. And the spread is not necessarily happening in public locations, like schools and restaurants, where masks, table spacing, social distancing, good ventilation is in place. Instead, it's people meeting in homes for small groups, for game night, movie night, small social dinners, overnights. This is where the spread is happening. Why are people doing this? Because people need to be with each other. It's as essential as breathing. Human beings are social animals, and our biological, psychological, and social systems have evolved to thrive in collaborative networks of people. We are not meant to be alone for months at a time. The good news is that we've learned a lot since the total shutdowns last March. We know more about how it spreads and how to stop the spread. There are people out there, unfortunately, however, pitting physical health against mental health, against education online delivery versus in-person, and short-term versus long-term economic health. The good news is we don't have to choose one over the other. It's not all versus nothing. There is a balance. We need to rely on the lessons learned, and that means using a dimmer switch instead of an on and off switch in regards to how we handle businesses and education. So, what is the right approach? There are places around the country that are doing it right, and what does that mean? For the individual, masks should be worn in every public place. If you feel any symptoms, even mild ones, stay home for a week to 10 days. Let your body stop being contagious and get tested if possible. If you do test positive, definitely stay home for 7 to 10 days. For businesses, municipalities and lawmakers can create guidelines and empower business to be creative. Use the health measures to keep businesses open, such as masks, distancing, hand washing, ventilation. When you do those things, it really decreases the spread. Other ideas for restaurants: limit capacity to 25 to 50% instead of shutting down entirely. Have plastic barriers between tables at restaurants. Limit tables to be 6 feet apart. Maybe it's a maximum of 4 or 5 tops. These are some ideas. For schools, do what other places have done. Everyone wears masks. Use separate entrances. Create pods. Eat in the classrooms. Go to school in shifts. Go to recess in shifts. Do partial online, partial at home any given week. Take kids' temperatures every day. Teachers can limit in-person interaction with colleagues and parents. Allow flexibility with attendance and ensure students do not fall behind if they need to quarantine to keep sick and exposed kids out of school. Make it so kids can seamlessly transition in and out of school. You can simply go online for the day or for a couple days. Return as soon as possible when you are well again. The phased-in approach being proposed by the ASD, I think, does not get kids to school fast enough. All kids need to go to school with a modified approach in person as soon as possible. So for hospital capacity, we do need to create and maintain capacity in hospitals. Not just physical space, but to make sure there are doctors and nurses healthy and available to provide care. After talking with several doctors, they have confirmed that the hospitals are getting pretty overwhelmed. But here are some of the ideas they discussed with me. It's important to deploy the same strategies as for mass casualty events. Some hospitals are currently blocking off a floor for COVID, using portable, engineered air system devices to create negative air pressure in makeshift rooms. We need to allow flexibility to address changes, meaning for a period of time, other doctors, like maybe an ear, nose, and throat or an orthopedic, can work under a pulmonary specialist, like 2 or 3 doctors, 3 or 4 doctors at a time, to help care for COVID patients. We should look for empty venues for additional space, and the state has done that with the Alaska Airlines Center. It is standing by. Local hospitals, I understand, is still doing elective surgery, albeit at a much lower rate. That is their lever to create capacity. The second round of federal aid funding is being deliberated right now in DC. I believe that there's going to be money for hospitals, for airlines, businesses, and individuals. We need to be ready for that. So going forward, this is sort of a summary here. I believe we need to look at the whole picture. The physical health of a person, the mental health of a person, and the economic health of a community. For businesses, implement health mandates because they work. Municipalities, don't penalize businesses with an on or off switch. Use a dimmer. Please keep them operating at least in some capacity. Use CARES Act money to help with creative solutions that allow businesses to operate safely. Municipalities need the revenue. People need jobs. We cannot live alone on Amazon.prime. Keep those hardest hit businesses afloat, those local companies that are the backbone of our community. Domino's Pizza and bike shops are doing great. Movie theaters and brew pubs, not so much. Think about the community we want post-vaccine and work towards that. COVID will have long-lasting psychological effects on people. Mental health is harder to identify and quantify, but it is no less real. Isolation, depression, and anxiety, these are going to be the big issues moving forward, and we need to be prepared to address it. We've got to support families, and that means getting kids back to school. This must be a priority. In-person school for all kids. As a state lawmaker, I will be focusing on swiftly allocating any new federal relief money to the most vulnerable individuals and the hardest hit businesses. It is important to understand and maximize the money coming in, state and or federal, to make the highest impact. I plan to work with the governor to reset the disaster declaration if necessary. I plan to work with other lawmakers to find balanced solutions that protect physical and mental health as well as the health of the economy. I'm learning as much as I can about the vaccine that's coming online. And my priority is going to be investing in the internet and broadband. I think it's crucial. We should have a healthy respect and reverence for the virus. But there are proven behavioral modifications that we can do to decrease the spread, which will allow us to carry on with our lives to some degree of normalcy. Pandemics don't last forever. They have shelf lives. And there are several vaccines just on the horizon. Hang on. The end is in sight.